The mandate of the Federal Ministry of Health is to provide quality stewardship for the health of all Nigerians. The ministry formulates and implements health policies to strengthen the national health system and make health services accessible and affordable. Since 2018, the ministry has been carrying out a health budget process reform.
Before the budget reforms was kicked off, there was an assessment that looked at the issues, with the budget process.
A key challenge that we had around 2017, which is not only native to the health sector, was this issue of us not being able to have a budget that aligns with our strategic plans.
The ministry sought for technical assistance from development partners, including the Bill and Melinda Gates Foundation and the United States Agency for International Development, USAID. They founded R4D to support the ministry implement a budget process reform.
When they came on board, they realized that the budget process, there was no synergy between planning and budgeting.
One of the key recommendations from that assessment was that there is a need to re-establish the planning cells or resuscitate the planning cells. And also, one of the key findings from that assessment we did with HSCL was that in budget, there should be a connection between the strategic plans or the policy and the budget.
R4D, in partnership with Sindani Group, assisted the ministry to introduce some reforms, including establishing a planning and budget committee.
Essentially, what they helped to do was to see that, first of all, the department responsible for planning the strategic direction of the health sector and the department responsible for holding the envelope were able to work with other departments, to ensure that there was this meet between the strategies of the ministry and then the budget that was given to the ministry.
The two departments that are involved, because we have the Department of Health Plan, Research and Statistics and Department of Finance and Accounts, have been able to work together harmoniously to put into practice the budget process in an effective and efficient manner, especially the health sector budget.
They try as much as possible to see how the two bodies can come together to see that the process have a very robust activity and then good coordinations that will move the health sector forward.
Other things that were done to achieve this was to ensure that capacities were built across the various departments and the agencies and the parastatals that implement the budget.
They came on board when most of the things were done manually. So they try as much as possible to carry not only the headquarters alone, but all the DABs, that is department, agency and parastatal of the health sector, and by forming what we call the planning cells.
Members of the planning cells were trained in budget formulation, implementation and monitoring. They are now able to direct and coordinate the budgeting process in the departments, agencies and parastatals of the Federal Ministry of Health.
They assisted in formulation, which is perfect, in budget execution, to ensure that yes, money meant for Project A is not diverted to Project B.
A lot of progress have been made. We have been able to now have mock budget, develop annual operational plans along those budget lines. So specific activities that will help to achieve better performance in our budget. And we've developed a template to be able to track that budget and see how it has performed on a yearly basis.
In 2020 and 2021, at least 80% of the health sector budget was informed by the annual operational plans. The reform has also resulted in timely submission of health budgets since 2018.
If we work together, we would fare better. Me probably asking, how have you spent your money? The need to have very clear, concise budget will not hurt anyone.
Understanding some of the underlying factors that are causing or making us to be unable to, even with the efforts we're making, That came out of engaging the process. And that's, for me, is the most important thing. And for me, is the key achievement.
First of all, we were able to put into the annual budget of the ministry a line item that has to do with the budget and planning committee. Because anything you are doing with that money, you'll succeed in nothing.
Another thing is, if you build the capacity of people, they can do it.
We are government enterprises. You move in, some move out. So there's need for that process to keep continuing, even when you have a new person into the committee.
Concerning the P&B committee, I came in as not a full member initially. What I have learned so far, I would say the alignment of the planning to inform budgets.
Another thing we are thinking, and of course the foundation is really interested in, is like, how do we translate the sort of work we have done and scale it down to the states? So the same budget process reform that Ministry of Health is doing at the federal level, can such be replicated at the state level?
What we're trying to do now is to go back and ensure that there's no conflict between national plans and sector plans.
It's doable. It used to be conceptual, like we think if we do this, but now we can see it's doable.
So universal health coverage is a journey. So, and Nigeria has started that journey.